The F500P full-body patient lift from Span America is outfitted with all the essential features required to deliver a high-value combination of care flexibility, ease of operation, maneuverability, and safety for both patient and caregiver. Note that 2 or more caregivers may be required for a transfer based on full assessment of the patient's level of mobility, weight and size, medical and mental status, and the patient's ability to assist in the transfer. For a chair-to-bed transfer, first we apply the sling. Lean the patient forward in the chair, getting help from another caregiver if need be. Push the sling down to the seat back to the base of the seat. Lean the patient back against the seat back. Lift the armrests, if possible, and pull the leg straps around the thighs. Lift one leg and feed the leg strap underneath the thigh. Repeat the process for the other leg. Once the leg straps are under both thighs, take the straps and crisscross one through the other and lay the straps on the legs of the patient. Open the base of the lift, approach the patient, position the lift, attach the shoulder loops to the first set of hooks closest to the patient. Then cross-connect the leg loops into the loops closest to the lift. Use the hand pendant to begin lifting the patient up out of the chair until the slack has been eliminated, pausing long enough to confirm that the straps are not twisted, the sling is not caught on the chair, and the patient is securely and properly positioned before resuming. Resume lifting until safely clear of the chair seat. Unlock the casters and maneuver the lift towards the bed. Close the base back down. Position the patient over the bed. Leave the casters unlocked for precise positioning. And begin lowering the patient to the surface of the bed. To remove the sling, you may log roll or use the head-up function of the bed. For this video, we use the head-up function. Bring the head of the bed up. Remove the leg straps out from under the thighs. Lean the patient forward and pull the sling out from behind the patient. Lean the patient back into the bed. Follow these same steps for transfer from chair to commode. The F500P can also be used to lift a patient safely from the floor. To do a log roll, first you decide which direction to roll the patient. You lay the arm closest to the caregiver doing the pushing of the roll onto the patient's chest, and bend the nearest knee. You then push the patient over onto their side. Place the sling on the patient with the shoulder strap at the shoulder and the leg strap down the thigh. Line the center triangle sewn into the curve of the sling with the tip of the spine. You then tuck the excess material under the body and lay the patient flat. Repeat the process on the other side, rolling the patient in the opposite direction and pulling through the material that was underneath the patient. Lay the patient flat again and bend the knees if they aren't already bent. Feed the leg straps under the thighs and bring them up between the legs. Crisscross the straps one through the other, and lay them on the legs. Now you are ready to move the lift over. Approach the patient, open the legs of the lift, and position the lift for the floor extraction. This can be done from different directions. For this video, we came in from the side and used a pillow to help protect the head of the patient. Run one leg of the lift under the bent knees and maneuver the other leg up near the top of the head. Use a pillow under the sling or have another caregiver help protect against bumping with the casters. Lock the casters and secure the loops to the spreader bar. Then slowly raise the patient until the slack has been eliminated, pausing long enough to confirm the straps are not twisted and the patient is securely and properly positioned before resuming. Then complete the lift. The patient is now ready to be transferred to bed or chair.